demonstrate for you the basic orthopedic or musculoskeletal exam. This is primarily for the first teams to see the patient, either the emergency department physician or the trauma surgery physician before the orthopedics are consulted. First thing you want to do is your inspection of the patient. You want the patient to be fully disrobed so you can really get a good look at the skin, look for open wounds, look for areas of contusion, any other signs of overt trauma. What we typically want to do after we inspect the patient is do a palpatory examination, and we combine that with a range of motion examination and a motor examination all in one. If the patient's awake, you're going to want to make sure you get a full sensory exam and a motor exam. If not, you want to at least make sure you inspect, palpate, and arrange all the joints and extremities. So what we'll typically start out with is around the shoulder area. You're going to palpate along the collarbone, along the clavicle, out through the shoulder, and around the back. You're going to reach and feel for the scapula to feel for any fullness, any crepitus, anything that might feel out of place. Next thing you want to do is range, just kind of palpate down the arm, palpate from the arm all the way down to the hands, and you're going to palpate literally every finger at every joint. You want to range the shoulder, make sure you don't feel for any abnormal motion, any crepitus, any blocks to motion. Range the elbow, you're going to range the wrist, and also range the fingers again. You're feeling for crepitus, anything abnormal, out of place, any blocks to motion. Next thing you want to do for the upper extremity with a patient that's awake is you want to check their motor examination. So we're going to check for their strength of their deltoid muscles. So hold your arm out to the side, keep it up like a chicken wing. I'm going to check their biceps. Pull back on your arm, please. Push it away for me. Cock your wrist up for me. Hold it up, cock it down. Okay, so what you're basically checking is some peripheral nerve function. This will be the deltoid is going to be your axillary nerve. Biceps are going to be your musculocutaneous nerve. Triceps is going to be your radial nerve, as is wrist extension. Wrist flexion will be your median nerve, and then you're going to ask the patient to give you a thumbs up. That's your radial nerve. Cross your fingers. Ulnar nerve, make an OK sign. You're going to be looking for a flexion of the digits here, and that's your median nerve again. So you want to make sure that gives you a gross inspection, lets you know that these nerves are grossly functioning normally. These are not a detailed exam, but it gives you a gross exam that you know things are pretty well intact. Next thing you want to do is check the pelvis. You're going to check the pelvis with a little bit of a squeeze in the front to the side, and also a little press on the front to the back. And what you want to make sure is you don't feel any gross crepitus. We're not trying to rip the pelvis apart here. We don't want to stir up any bleeding. We don't want to make things worse than they are, but you do want to feel for signs of gross instability. Next thing we're going to do is come down to the lower extremity. We're going to again start at the hip and work our way down. You're going to palpate, feel along the entire leg, make sure you don't feel anything grossly moving around, any crepitus, anything out of place. The next thing we want to do is range the hip. So we're going to flex the hip, internally rotate, externally rotate, look for signs of pain, crepitus. Same with the knee, flexion, extension. And while you got the knee there, just make sure you don't see any gross sagging of the knee, and then you're going to give it a little bit of just a varus and valgus stress, okay? Varus stress, valgus stress, checking for any gross ligament examination that might show some abnormal signs of a knee dislocation or any other traumatic injury. Again, you're going to come down to the ankle. Again, moving the ankle, moving the toes, and palpating, look for any signs of abnormality. Next thing we're going to do is just check some basic motor function. Just have the patient hold the hip up in the air, resist, and have hold the knee straight. Don't let me bend your knee. Checking the femoral nerve. Push down on the gas for me. Good. That's your tibial nerve or the sciatic nerve. And pull your foot up for me. That's checking your deep perineal nerve, also the sciatic nerve distribution. That's kind of your basic orthopedic examination, just roughly looking for any obvious deficits, obvious abnormalities. You're going to repeat the same thing on the other side.